My belief is that we publish the work that we undertake in the reports that we produce in order to allow people who are choosing services to make an informed choice. I don't know any of you that have moved areas and selected schools. My guess is you'll go on the Ofsted website. But how many people choose maternity services based on the results of where safer and more effective maternity services are? If I'd have known in 1983 and 86 what I know now, I would certainly look at our reports. We have a site on our own website called Share Your Experience form, where we get emails, phone calls, letters. 75% of the information that we get is a concern about care. 25% are positive comments. We do get them. We analyse the comments about services posted on websites, choices, patient opinion, and Neil, your own. We look at this material and draw it together. We have a number of arrangements with Age UK, Childline, Relatives and Residents Association, Action Against Medical Accidents, Carers UK, the Patients Association, where they will receive information and passport it to us. So it's not just people coming on our website, it's also about using the leverage that others have. So this is what came through this website in this 12-month period from November 14 to October 15, where, as you can see, we've broken this down, about 36,000 contacts in a year. That's, I think, an awful lot of information coming back, expressed as a percentage of the total number of people using health and care. A lot of people think we've got some role in satisfying their individual complaints, resolving their individual complaints. People think we are in a position of authority over all of you, and that if you tell us about it, we can make you do something that you are refusing to do. I think the more that comes to us, the more that's a signal of resolution at a local level is not working. We are commissioned mainly by the Department of Health to do 4 patient surveys. They're not done every year, but the majority of these are done on either once every 2 or once every 3 years, and have been going on now in some cases for about 12 years. So there is comparative data that allows us to track whether this sentiment is actually improving. Actually, it's not about what your score is here. If your score here is 90%, it's do you know what's in the other 10%? Because actually that's where the harm is likely to have occurred. I get really awkward about whether we should be doing patient surveys. They seem a bit yesterday. I have to say this with Neil being here. And, but actually the remarkable thing that there is this trend data which has been going on now for quite a considerable period of time. The great news is for the majority of this, the maternity survey, A&E, acute health, people are feeling much more involved. There's clear evidence over these surveys over a number of years that there is progress being made and more people are feeling involved in their care. We've now completed all acute health trust inspections, and at the end of this month we'll complete all community ambulance and mental health inspections, so we'll have completed all NHS trusts. And when we've asked people about what we do, not chief execs but ordinary members of the public about what we do, they do want to see our reports, they do want to see the ratings. So we might get exercised about our ratings, and I understand why that might be the case. But actually people want to see these ratings. They want to see what the service is and how the services are being rated at a local level. We've done all these reviews, but actually the reason we produce these documents and publish them and share them and making them available is so that people can have a look at them and then use them to encourage improvement. I don't know, if I was still doing a proper job, I'd be getting these and stealing them. Say a little bit about our ambition. Our ambition is a more targeted, responsive and collaborative approach to regulation, still keeping our purpose. We have a baseline now, probably unique in the world of having a baseline of all NHS trusts in terms of quality and safety as a result of those inspections. We don't think the answer is to go around and do it again. So what we will do is look in a more targeted way. We want to have an approach where we've got a single agreed definition of quality, and the data we collect is consistent with that definition of quality. So what NHSI collect, what we collect, what NHS England collect can we reach for a position where that's the same?